Congratulations. With a BMI of 32 to 37, you fall under the category 3 that we've created here. Now, on each of these categories, it's going to, based on BMI, it tells us the volume that will be removed and allows us to maximize the amount of fat we get out of a treated area while keeping it safe for the patients. So there's various recommendations based off your size, and the upper body would be the first package that we offer here, and that's treating of the arms. And when we treat the arms, we go circumferential around the arm with exception of the front part of the arm over the bicep to avoid this big blood vessel. We go all the way up to the shoulder, all the way up to the armpit, and then down to the elbow to take care of the entire problem of the arms. We also treat the front bra roll, which is the underarm area, and as you get larger breasts, your breast will roll into the armpit, and so by taking away the underarm, we define the side of the breast and get rid of that fullness under your armpit, which may keep your arms sticking out to the side. We also will treat the back bra roll, which is the upper back area. In the upper back area, you may get fullness, which causes folds under the bra area. It also makes your back look wide. Some girls think that it makes you look like a linebacker. The girls have said it's a kind of a joke, but you may feel wider, and so these back bra roll and reducing it will make you more narrow. At this level, you may also have this issue with the buffalo hump, which is the fullness in the area just behind your neck. And that makes it look like you're hunched over when you're not really hunched over. So that taking away that fullness makes it look like you have a better posture. We also treat the chin area, chin and neck and the jowls. So we go above the jawline here, and doing that, it creates a more oval face. And then we also go below the jawline, and we do that, it creates that line there and makes you a better side profile. The next option would be the midsection package. And so we have, at this level, it's since patients are a bit larger, the accumulation of fat around the midsection precludes us from doing 360 lipo. So at this level, we need to split it up into 2 separate procedures in order to do the full 360. So the first part of the procedure would be the front of the abdomen, and where that covers, we're going to go just below the breast line, all the way down into the pubic area as far as we need to go to get everything in the front. And then how wide we go, typically how wide we go is our goal is to get rid of the fold, and so we go wide enough to get rid of the entire fold. So typically if you put your arms down by your side and draw a line down from the front part of your armpit, it's about how wide we go. But also if you follow this ridge or this fold down at the bottom, it'll wrap around to the sides, and we need to go about that, as wide as that roll goes in order to take care of the whole front of the abdomen. The goal of treating the front of the abdomen is there's a couple really big proportion things that we need to change. Is if your belly is sticking out further than your breast, we got to change that so the breast will then be sticking out further than the belly. We want to make that belly flat. We also want that fold that you have, we want that to go away completely. You may have some scar tissue with C-section scar that shouldn't be an issue. But we want to make that fold go away completely, and so we have to go down below the fold into the pubic area and remove all the volume there, and then get wide enough so all the weight that's pulling down will be alleviated and everything retracts back and the fold diminishes. Once you finish the front of your abdomen, so that would be one procedure. Coming back for the second part of the 360 lipo would be completing what we call the waist. And so the waist would be on the sides, you have the love handles and the hips, so we're creating that hourglass figure. And then along the back, you're going to go all the way across the lower back to complete the 360, and that will do a few things. As you fill in the lower back, it makes your back more straight up and down, that's naturally what your curve is. Naturally, you have an arch to your back. So when we treat all the way across the lower back, we create that arch, but it will simultaneously make it appear that your butt's sticking out further because we've created that arch in your lower back. On the sides, and taking down the sides, we're creating that hourglass figure and elongating your curves. Individuals at this level, we're going to get at a significant amount of fat, which you need to be concerned about large volume risks, so please watch that large volume risk video. Regarding the lower body, the next option for this level is the lower body. The lower body consists of the inner thighs, all the way down to the knees, the outer thighs, as well as the banana roll, which is a little strip underneath the butt there. And now in treating the thighs, it will narrow out the thighs and alleviate some of that rub that you might get from the inner thighs there. Helps you fit into your pants a lot better because we're taking circumferential volume away from the thighs, and just gives you a more streamlined look, a more lean look. Now people at this level, you're going to have a couple different options with the lower body. The less aggressive approach would consist of the inner outer thighs and knees, so the inner portion of the thigh, the upper outer portion, and then that banana roll. But on some individuals that may not be sufficient. You may have an abundance of fat, particularly on the front of the thigh and down towards the lower outer part of the thigh. And these individuals will consider treating the full thighs, which is a more circumferential treatment of the thighs. We get significantly more fat, and it covers more of the front of the thigh and the outer lower portion of the thigh. And these individuals just need to take into consideration the risks concerning full thighs. So this is something that you're going to want to discuss with us and try and weigh the risks and the benefits to make sure that this is the right option for you.